or questions, please feel free to select prefer not to respond if you would rather. And with that, we don't have a lot of slides today, but I do have an opportunity for us to engage with some questions. And with that, I want to put those up on the screen here as well. And now I'm going to adjust everything. A few more people joining today. Fantastic. A large group today. Thank you so much for being here. All right. Hopefully our panelists aren't nervous. I told them we typically have between 16 and 20-ish people because that's kind of been our average, but our last two office hour sessions have been much larger than that. And I'm grateful. I hope that means that you're finding these opportunities to be beneficial to you and responsive to the needs that you are letting us know that you have. So in our April Learning Community Call, one of our focus was to really provide opportunities for our local and tribal health departments to understand the work that is happening in schools and to see themselves in opportunities that schools may present around adolescent well-being. And Libby did an amazing job from the DPI, really giving us an overview of the school mental health frameworks, touched on the new bullying prevention curriculum, and also really gave some suggestions of where maybe health departments could see themselves in their opportunities connecting to schools. The next step we really felt was to bring some school professionals into this office hour space and ask them some questions and allow, hopefully, to create a really nice free-flowing dialogue. So an opportunity for school professionals to let us know how they could see health departments supporting the work that they're doing around adolescent well-being. And also to just give us a sneak peek into what it looks like to address adolescent well-being from the school perspective, and what some of those really common entry points might be, because we know that that's a common question that we've been getting from local and tribal health departments is who do we reach out to? Who might be the best point of contact? And many of us in Extension have a past history working in school districts. Myself, I worked as a school nurse and a school counselor. And so I have a bit of an idea for the districts that I've worked with and that my family's been a part of, how you might gain access and entry, but there may be other perspectives that could be shared as well. So we do have some school professionals joining us today as a part of a panel. I created some question prompts that I sent to them so they could just have a little bit of an idea of what we might be looking for today. And in all honesty, I would really love for this to become just a really nice back and forth dialogue for the hour that we have. So I created some question prompts based on the feedback and the responses we've gotten from the local and tribal health departments. But please feel free to unmute yourselves, ask questions. And again, let's create a back and forth dialogue in this space. And we are recording this session so that it can be viewed by individuals that aren't able to be here as well. So it will be beneficial for your colleagues around the state that aren't able to join today also. So with that, I did want to give everyone an opportunity to introduce themselves and connect. So first off, we're going to welcome our school-based guests. We've got Nathan Beck from the Madison Metropolitan School District. There we go. Nice wave. Thanks, Nathan. Amber Haluska, and I'm not sure if she has joined yet, but she is working on it. We all know that things happen in schools, and just because you had this on your calendar doesn't mean that nothing else came up in health departments as well. And then we also have Pete Hopke joining us from the Solon Springs School District. All right, thanks a lot. So before we let them tell us a little bit more about who they are, I thought that it would be good for all of us to do a little bit of an introduction to the school professional panel that is here today as well, so that they can get an idea of who you are and where you're coming from and the work that you're doing. So on the slide here, you see the lovely one-page document, Youth Engagement 101, that Taylor Steele and the Patch Youth created, and she shared that with us at our April office hour session as well as during that learning community call. And so what we would love to have you do today is just introduce yourself with your name, your county, school, or organization that you are representing today, and where are you at with youth engagement around adolescent well-being. And so really we're looking for like a 1, 2, or a 3. You're in that assessment phase. We're really just kind of planning and preparing, trying to understand what it even means to engage youth. A 2 means we've assessed. We're always assessing, but now we're also connecting with youth. And 3 means we are working and innovating and doing great work with the young people that we engage with. So just let us know where you're at, a 1, 2, or a 3. We've got a large group on, so we'll keep it really short and concise. And as we've done with introductions in the past, I'll call on someone and then I'll put someone on deck as well so that you'll know kind of what that flow is going to look like, and we'll just keep ourselves moving along. So quickly, I'll introduce myself. My name is Danette Hopke, and I am the Behavioral Health Outreach Program Manager for the UW-Madison Division of Extension. And I would say that we are a 3 in the extension space and in the behavioral health space, and more specifically this MCH space, because of the work that we are doing with the Patch Youth and that Youth Wellness Advisory Team. I'm going to jump to Zoe, and on deck will be Nathan.
Hi everyone, my name is Zoe Gibbons. I am a graduate assistant with the MCH Adolescent Wellbeing team.
All right, Nathan. And then I'm going to go to JD on my screen.
Hi, I'm Nathan. I'll talk a little bit more later, but I work with MMSD, but I'll share a lot more later.
JD, and then Jessica. And some people, sometimes we have to step away or can't unmute. So let's go to Jessica and then Jen.
Hello, I am Jessica. I'm at the Forest County Health Department. I'm a staff nurse there. And in our county, we have Leona School District, Crandon School District, and Wabeno School District. And I would say we're at a solid 2-3 with them.
Great, Jessica, thank you. Jen, and then let's go to Pete.
Hi, I'm Jen Tanhera, public health nurse at Oneida County Health Department, and I'm new here, so we are starting over with the whole adolescent well-being and totally in the assessment stage.
Great, thanks. Pete, and then Debbie.
Hi, Pete Hopke, superintendent for the school district of Solon Springs. We're one of 3 districts in the Douglas County region, or Douglas County region, and happens to be the smallest district there. A lot of focus goes into Superior, but I would say in our district, we're quickly approaching 2 as we really start to ramp up.
Debbie and Molly will be on deck.
Good morning, everyone. I'm Debbie Mollendorf, and I'm a health and well-being educator with UW-Madison Division of Extension, helping to support the MCH technical assistants. I'm so happy to be here with you today.
Thanks, Debbie. Molly, and then Karen Kropp.
All right. Hi, everyone. I'm Molly. I'm a public health specialist for Jackson County, and I'm also very new here. And I would say we're kind of at the assessment stage, moving really close to connection.
Karen and Trisha.
I'm Karen Kropp-Miller. I'm from the Taylor County Health Department, and I would say we're a good solid 2-3 in some school districts within our county, and 1-2 in others.
Great perspective to share. Thanks. Trisha, and then Angela Mayer.
Hi, I'm Trish. I'm a public health nurse from Buren County, and I would say that we are in the assessment stage.
Angela, and then Megan Lindau.
Hello, I'm Angela Meyer. I'm the public health planner for Trempealeau County Health Department. We have been in the assessment stage. I've only been there for about 6 months, but over the summer into the next school year, we will be starting our connection phase for sure. We have some plans in the works.
Thank you. Megan and then Carla.
Hi, I'm Megan Lindau. I'm one of the public health nurses with the Clark County Health Department, and I would say we are at a 2 with most of our schools.
Megan, Carla and then Renelle.
Hi, Carla Melky. I'm a public health nurse for Adams County, and I would say we're probably a 1 in the assessment phase.
Great, thanks. Renelle and then Amanda.
Hi, I'm Renelle. I'm a public health nurse for the Ho-Chunk Nation Department of Health. We serve 15 counties in Wisconsin and 1 in Minnesota. So based on that, I would say we are somewhere between a 1 and a 2, depending on the county.
Thank you. Amanda and then Kelly Davidson.
Hi, I'm Amanda Hawkins. I'm the public health assistant for Florence County. And with our school district, I would say we are between a 2 and a 3, probably closer to a 3.
Kelly and then Emily.
Hello, my name is Kelly Davidson. I am a public health nurse with the Hills Corners Health Department. And we are currently at a 1. We are still assessing our community, our school district.
Emily and then Taylor.
Hi, I'm Emily. I'm with Barron County Public Health. I would say we're between a 1 and a 2. Some of our schools were starting more of the connection.
Taylor and then Heidi Massey.
Here with Danette. We love to move, as Danette said, in that number 3 space, that innovation. We're always looking for, in particular, how youth can be change makers and researchers alongside adults. And that's a huge part of my role as a youth outreach and engagement specialist.
Thanks so much, Taylor. Heidi and Kaylin.
Hi, I'm Heidi Massey, and I work with the Division of Public Health, and I'm one of the contract administrators with MCH, Adolescent Wellbeing.
Kaylin and then Carrie.
Hello, Kaylin Dorniak with the South Milwaukee St. Francis Health Department. I would say for about half of our schools we're at a 1, the other half would be a 2.
Thank you. Carrie and then Denise.
Hi everyone, Carrie Wardias, public health nurse with the Oak Creek Health Department. I would say we are between 1 and 2. We are working with our high school right now to try to implement Handle with Care, which is a big step for us.
Great, thanks Carrie. Denise and then Erica from Patch.
Good morning, my name is Denise Cahoon and I work with the Wisconsin Department of Public Instruction. I would say my specific role focuses on assessment because I work mostly with the Youth Risk Behavior Survey and the School Health Profile Surveys, which work with both school districts and students.
Great, thanks Denise. Erica and then Lily.
Hi all, Erica Kepsel, she, her pronouns from Patch, Providers and Teens Communicating for Health. And I'd put us at a 3 in many ways with our partnership with UW Extension and also just the youth we've worked with for years.
Thanks for being here, Erica. Lily and then Cassie.
I'm Lily Wexner, nursing supervisor at Outagamie County Public Health. It depends on our schools, but I'd say we're between a 1 and possibly a 2. Our schools are very independent and have programs already in place and they kind of do their own thing. So it's a little bit of work trying to get into them.
Great, we're glad you're here. Cassie, and then, oh goodness, let's see, who am I missing? Mallory.
Hi, my name is Casey Solsley, and I am a research and evaluation consultant and the YRBS coordinator with the Wisconsin Department of Public Instruction. And much like Denise's, I feel like my role fits mostly in 1. Thank you.
Sorry, Casey, for pronouncing your name wrong. Mallory, and then Heather.
Good morning. I'm Mallory Beck, Community Health Supervisor at Walworth County Public Health.
Just a second, let me get this.
think we're somewhere between a 1 and a 2.
Thanks, Mallory. Heather, and then let's go to Tammy.
Hi, my name is Heather Feast. I'm with Manitowoc County, and I would say that we are at a level 1.
Thanks, Heather. Tammy, and then Joanne. Oh, Tammy, we see your lips moving, but we can't hear you. There we go.
And I'm not actually in the youth engagement thing, but I'm thinking about it for next year. So I'm trying to get information, but we'd be at a 1.
Great. Well, we're glad you're here. Reach out anytime. All right, Joanne, and then Jessica.
Joanne Baracco at the Price County Public Health Office. I'm a public health nurse here, and I would say we're probably in between a 1 and a 2, closer to a 2.
Thanks, Joanne. Jessica, and then Rachel.
Hi, I'm Jessica. I'm from Burnett County Public Health, and I would say we're at a strong 1. We're definitely working on it.
Great. Rachel, and then we'll give JD one more chance.
Morning, Rachel Patashik, Chippewa County Department of Public Health, Chippewa, Falls, Wisconsin. I'm a public health nurse, and I would say 1 to 2, closer to a 2.
All right, JD, if you are back with us and able to jump on, it looks like we may have lost JD. All right, that's okay. With that, so I also just want to acknowledge that wherever you're at in the process of engaging with youth in your health departments, in your schools, it's okay. One of our roles is to help you build your skills around assessment, build skills around connection, which is a bit of the work that we are doing today, and then innovating too with those young people. So we look forward to, again, over the course of the remainder of this year, helping you to understand what it looks like in each one of these steps of that youth engagement process. So with that, I am going to, whoops, sorry about that. We're gonna jump to some discussion time. And I'm going to actually stop screen sharing and just dive in a little bit to our questions that we posed out to our school district professionals before they joined us today. Again, we'd really love for this to be a back and forth dialogue. So I'll throw questions out there to them. They can respond and share their thoughts. But then if you have additional questions for them or comments, we'd love to have those as well. So the first question that we gave them to think about was, what are the greatest needs around adolescent well-being that you see in your school or in your program? So, and then, and I know for sure we have Nathan and Pete, and I'm not sure if Amber has been able to join us yet. So we'll just welcome her. Oh, and something
Unfortunately,
came
Amber
up.
won't be able to join. She had an emergency come up.
Oh, I see that. Yes. Okay. So Pete and Nathan, you have the extra time on the floor today.
Oh, wonderful. So just trying to get into this a little bit, just to give a little background. So once again, superintendent in Solon Springs, little district just south of Superior. It's in Douglas County. This is the 5th district I've been in. I've worked in St. Croix County, Washburn County, and now Douglas. As a revisit for Douglas. I will say that each county has been a little bit different, and the needs are slightly different, but I would say a lot of the same things keep coming up, and that's accessing additional resources, accessing providers, whether it's counseling, whether it's CCS programs. I think that is truly it. Where I'm at right now. I was in the Spooner School District, which was in Washburn County, for the past 5 years. And I would say that, I had a pretty decent relationship with the county's workers there and the county resources, as well as outside providers. I had a pretty healthy list of providers. Even with that, it was difficult to get kids that weren't accessing services previously in to see providers. Coming into Solon Springs, which, like I said, there's only 3 districts in the county. Superior, there's a lot of focus on that district there, and not much here. I would say that I reached out to a lot of the same resources or people that I knew when I was working in the Superior District. And I will say that I only have one provider that's consistently coming to the district. So it's even more challenging, I think, for some of the districts that are in that more rural area on, accessing resources and having that ability to impact well-being and mental health. Because I've got a lot of kids that, they live out in a very, very rural area and not much access. So, and we've been seeing a lot of mental health issues within the building. And that gets into staffing. We were struggling to get a school counselor full-time in the district. We will have one next year, but we were able to bring in a social worker part-time to get us through the year. Her days, she's here 3 days a week, packed from start to finish, talking with kids, working through concerns and issues and the mental health concerns that they have. And that so rubs off into, day-to-day interactions between students and staff. And thank goodness, we have this person coming in. Otherwise, that it just creates a more challenging environment, just getting through day to day, let alone the instruction.
Hi, everybody. Nathan. I almost joined Amber with an emergency. I've been watching my text because our dog got out this morning, but I just got a text message with a picture of her very muddy, but safe. So I'm present now.
Great.
But I am with the Madison Metropolitan School District, and I'm going to answer things from a slightly different lens, maybe. So you've probably heard more from people that are working specifically on adolescent mental health about all the interventions, all the work that's happening. And that's all great. My role is in partnerships. And so I'm going to be speaking mostly from the lens of how do you partner with schools, right? What are the things? And also my role is a little bit unique in that every single initiative that I do or I work on relies on several other organizations also doing things. And so I think going to speak from that lens. But I think the way that I approach the adolescent mental health, first and foremost, is we've got a lot of data in Madison that says schools are really not very good at supporting adolescent mental health. They're not spaces that young people always feel good and safe in. We did some youth participatory action research locally with young people that said, where do you feel safe? I can't remember the numbers off the top of my head, but it was like 20% said that they feel safe at school. Compared to 75% that said they feel safe at their neighborhood center. So we've got a lot of different other community-based organizations. So, and what is it about that? And I think, schools are obviously amazing, incredible spaces. They're really bureaucratically and curricularly constrained as to what they actually can do compared to places like community-based organizations, right? I think the work that Extension does with youth across the state, that has a lot more flexibility, that's able to actually meet the needs of young people where they're at. And so I think that is where a lot of my lens goes. And how are we supporting adolescent mental health is we're really trying to support them accessing spaces where they're having increasing adults that they can trust. And so we're also thinking, again, a lot about these, what are the things that drive mental health? And one of the things that we see, and I think about a lot, is the more access that young people have to adults that they can trust, the better their outcomes are. That's what our local data says. And so, I think of it as much as often as how are we creating spaces where young people feel seen, feel loved, feel valued within our schools, but also recognizing that our schools are not as good at that always because of constraints, right? They've got testing, they've got a bell schedule, they've got all these things, not always super welcoming to families for lots of good reasons, right? And so we're trying to think of how do we create spaces and support spaces where they're actually gathering, where they really do feel seen and valued and welcomed and belonging in a different kind of way, where organizations are able to meet their needs and in culturally relevant ways and connect with their families. So I think that's mainly what I think about is how do we create spaces where young people are increasing contact with adults that they can trust.
Thank you both for your answers to that question. And I love that we have two very different perspectives on the call as well. Any questions from before we don't need to just run through the list of questions that I came up with. Does anyone from our health department teams have a question or a follow-up, anything you'd like to throw out there? For me, the thing that resonated listening to both of you was acknowledging, right, the constraints and the challenges that schools face in all different ways, and yet also that desire to meet the needs of students and families, and the everyone knows, we all know, right, the value of adults, carrying consistent adults in the lives of young people. And so when we can think as health departments, as schools, as external organizations, about creative ways to make those spaces that maybe look outside of the boundaries of the bell schedule for a school district. I think, and I think, again, my past experience would say that schools are very interested in those creative ways to connect and support students, because they know that during that bell schedule, it is really hard to meet all those needs, and finding other ways to be the hubs and the resources in the communities. I'm curious if any health departments that are here today have examples of that, where you may be working either with your schools or with other organizations in the community to create those spaces for young people outside of the traditional kind of school schedule. Any health departments doing anything like that? Oh, Renelle. Renelle, would you like to share, or you can just also raise your hand? That's okay too. I don't mean to put you in the hot seat.
I never know how to like speak into things without cutting other people off. So the tribe has what's called youth services, which could kind of be like an after school program, but it's culturally based. So they learn like beading and mocks and different cultural aspects. And we have community health representatives within the public health division that have been doing bi-monthly programming with the youth. So they have like days where it's little, so like elementary, and then days where it's big, so like middle school, high school kids. And that's been going really well, just getting our staff out in our different areas more frequently, so they know the faces, they know they're going to keep coming back.
That's great, Renelle. Do those what time of day and days of the week do those typically take place at?
So it's Monday through Friday. Kids get dropped off from school typically on the bus, and I think they usually go home like 5:30, 6 o'clock. So they get a meal. You know, a lot of our kids live below the poverty line, so it might be what they eat for the rest of the day.
Thank you so much for sharing that.
That's amazing. That's really, really cool to hear. And I think like it sounds like not as many others are maybe thinking in those ways. Renelle, I think it's amazing. And I'd encourage other folks to think about partnering with after school organizations too. A lot of times they'll be a lot more flexible and able to be creative. They'll have other constraints. They'll have a lot less money and other things, but they'll be more flexible with that thing. Often better connected directly to families than schools are because of those things. And I think the thing also long-term, you know, often with after school sites, you know, if you have a long-term relationship, you're going to see the kids from 1st grade through 5th grade or whatever, or 6th grade through 8th grade. Rather than kind of being more segmented. And so kind of the opportunity to build longer term relationships with the young people and families.
I would agree. And I would say it wouldn't necessarily have to be limited to health departments. When I was like going back to my past years here, working in Spooner, we had local law enforcement that would come in with the after school programs and do do different things with kids and build that positive relationship, which then, you know, if in these smaller areas, when you have mental health crises, people that are going to be responding are going to be more of your law enforcement. So having some of those positive connections and building those positive connections are great. And then I would say, yeah, the tribal units and increasing their presence and involvement in the school districts. That was a great thing that we had with the St. Croix Band of Ojibwe. We had them come in just not only for instruction and cultural pieces with fourth grade classes and elementary, but then also getting them involved with seeing kids on a regular basis and you know, working them into different events and seeing the positive way that they can impact our students too.
Great.
Yeah, and I think like that gets to maybe just like a strategy or like a principle that I really believe in partnership work matters the most. It's partnership work is hard, right? And particularly with schools, because schools have 100,000 expectations on them, right? 100,000 things to do, and all of it's urgent, right? And money's going down, so it's like it's a really, I think, complicated environment to partner with because there's so many urgent needs, and so many other things on the agenda. And what I always come back to in my partnership work is people are going to engage with you if you add value, right? And so that is like the first and foremost thing that I always think, like, how am I adding value? You know, and calling and asking a question, calling and asking, how can I partner? Calling and asking, can I come visit? You know, is probably not adding value, and you're going to get some exceptional people that are like, sure, come, let's figure out partnership. But if you're able to really clearly come and add value, people are going to want to engage with you, right? And that's going to build the long term. And so I think what Pete's describing, you know, it's like it's these perfect examples of like, oh, like I see, like these people are actually coming in and adding clear value. They're giving good content. They're creating relationships. They're probably making my day a little bit easier, right? Because there's some good content to deliver. So I do like that is like a principle that I always come back to in partnership is how am I adding value? And I often also think, you know, if I'm reaching out and people aren't partnering, I always put the blame on myself, right? It's again, it's like it's questioning, okay, what am I not getting? How am I not adding value to this? And so again, because recognizing that the context of schools and a lot of spaces, community-based organizations too, is they've got 15 middle schoolers running through the door in 10 minutes. And that is like the pressure and the drive that they're under. And so it's not super easy always to step back and think, oh, let's imagine what a partnership could be, versus being able to go in and say, this is how I can and will add value to your work that builds a relationship and connection long term.
That's great, Nathan. That's one of the things that we often say in extension when we are working with our educators or with external partners as well is not just asking for time and but to provide a resource. And I love how you said that, to add value as well. With that, I think I want to ask the question, because I know this is a burning question for many of our health departments, is who in your districts or your programs could be key points of contact for our local and tribal health departments to build collaboration around adolescent well-being. So sometimes, again, as you heard when our health departments did check-ins today, they sort of shared where they're at. They're still assessing what it means to look like, or what it means to engage with youth. Some are at a place where they're starting to connect with youth, and others are in that innovative space. But for those that are in that assessment phase specifically, or maybe trying to connect in other districts, or external programs to support youth, who do the two of you recommend that they reach out as a point of contact in a school district? And I think I might add a second piece to that question. If you have additional examples of what adding value could look like, again, looking at that adolescent well-being perspective, that could help our health departments maybe see what value it is that they could bring to the table in those conversations. So two pieces, I apologize. Who are those key points of contacts in your districts or organization? And what might be some additional ways, Pete, you shared some examples, but some additional ways that health departments could add value to your school or organization?
Well, So like I said, I've been in a few different districts here, and I would say there are some common themes here. School counselors are usually the first line of defense when it comes to mental health and well-being, and probably the first contact with establishing those connections. But then I would say going into director of student services or pupil services is usually a good connection too, because then you're interacting with leaders that are involved with students with disabilities or mental health concerns, or overseeing that school counseling program. And then you could get to districts like mine where I'm one of them, it's just because the size of our district, I play many roles here. So I think it's reaching out to those administrators, those school counselors, looking at the district office and starting that connection. And another in might be if there's a student that you're working with from that district, asking those students, who do you see and who do you talk to, and begin working your way back that way. So
I like that you also suggested administration, and just from my past experience as a county-based educator, knowing that sometimes you're right, we shouldn't be afraid to reach out to school administration as well, because you just don't know who will have the time and see the email in the right moment, and know that there's a variety of people, and that suggestion of connecting with the students and who are the important people in their lives in the school. That's great too. Nathan, what are your thoughts on that one?
Yeah, I mean, I echo, it's like anyone and everyone, because I think it varies so often school to school, who is the key person that drives it all. Sometimes, like a lot of times, it's the secretary, right? Who gets all this stuff done and follows up. And so I think it depends, and it's based on relationship. And I'd say, again, don't be afraid. It's like reaching out, building relationship and connection across the schools and districts. I do love Pete's idea of talking to the young people, saying who is important to you, and then going there, because that's like a shared interest immediately. It's like, I work with Pete. It's like, I noticed this. He says that you're a great guy or a great teacher, and I wanted to know more about how I can support your work. And I work in MMSD, like I work for the district, right? I'm in the partnerships office. I often advise people not to go through the district partnership office. Because like it's a relatively large bureaucratic process, right? Where it's a lot easier often to go and start something, right? At a small scale based on a personal relationship where there's already a connection. Like, like Pete said, we know these kids together, let's work on something together. Then like we can elevate, we can scale, we can do all those other things. But yeah, I'd say anyone and everyone, and it varies. And I think a couple examples of adding value, I think buying people lunch is kind of this very basic token way, or bringing food to things is something that I try to do a lot. When you can stipend people for their time, do so, right? Often we're asking, educators and other people who are already working hard to work more, right? Or to do something collaboratively that's extra labor. And so we always stipend it. I have been able to stipend individuals directly, which has been a great thing. Sometimes you might stipend the district or the entity itself. But it's also, I think, saying, I think like Pete's examples of people that are coming in and offering content. I think it's being willing and able to come in, right, and offer content or offer support or offer connection. So it's going in with less of an agenda, and going in to build a relationship and connection. And then like you'll bring your agenda eventually. But if you go to a school or a superintendent or a teacher and says, I have this survey that I'd like to get done. A few will say yes, right? Probably not very many. Versus if you go and say, like, we're working with, shared families and shared young people on shared issues. I see the work that you're doing. It's great. I'd love to come in and volunteer and support. Do you have an after school club? Is there content that we could give during a health class? So I think it's like those kind of things of how is this going to reduce, add value to their work, reduce their burden, give extra labor. And then again, from there, you bring your own agenda, right? But it's from a place of relationship and connection, and people seeing you as people that get stuff done, and add value. Really, I think shapes it better.
It's great. One of the things that, oh, I apologize. Go ahead, Pete.
No, I was just kind of going back, thinking about this a little more too. Yeah, I think you have it right there, Nathan. Being willing to come in and just volunteer and just be there. I would say that that's one thing that I've really encouraged, with the health department as well as law enforcement, is just get into the building here. We'll find a space for you. There's plenty of kids to interact with, but be willing to come in and just be here, and be persistent as well. I will say that, with the my current local health department, great people, but they weren't used to hearing from someone from the district here. So after 4 or 5 times, they're like, oh, they know who I am, and we're willing to work together, and build those connections. So.
Yeah, that's a great reminder too. I think on that persistent side, sometimes, again, from my past experience and perspective, we can worry about being annoying or irritating, or like pushing too much. But sometimes it's just not the right time. And then when we are persistent and continue to pursue it, we may it might just be the right time. And so recognizing, again, as we've all said, both health departments and schools have a lot on their plates, but continuing to work to establish those relationships. One of the things that,
like one more point, because I think it's like, once you establish yourself as somebody who gets stuff done, right, and adds value, like people are going to want to work with you, right? And so it's like, it's thinking about it as like you're building conditions that are going to be good for the long haul. Like, and so even if you're you feel like you're not getting what you need out of it, it's like, again, setting time and intention to get stuff done for people and add value, like sets up people are going to want to work with you, right? Long term on whatever that is, because they know you as people like, oh, when I worked with Pete, like he did some cool stuff, like he added value, he made my life easier, like he's going to text me about something else, I'm going to say yes.
Great point. Yes. I also just want to acknowledge Debbie did put something into the chat. So please feel free to use the chat as well. And she said from her past experience, when there is a change in a person in a role, it's a great time to just reach out and introduce yourself as well. So just not being afraid to overwhelm or bombard people, but just to take those opportunities when change happens, to reach out and connect and begin to build those relationships in those spaces. So what I started to say earlier too was that, and I'm grateful that we have some of our DPI colleagues and partners on the call today. When I met with Libby and we prepared for the April Learning Community call, one of the things we talked about is really working hard to build this sort of triangular, but not in a bad way, a triangular relationship between schools, extension, and our health departments, and figuring out how we can all work together to support each other in the work that we do. And I already acknowledged, we know that schools are strained, but we also know that our health departments are strained, and we see high rates of turnover in both of these professional organizations. And so in order to give Nathan and Pete maybe an opportunity to hear a bit from some of you, and again, others that may watch this call later on, I'd love for some of you in the health departments to talk a little bit about how you are engaging in that 1, 2, or 3 sort of step in youth engagement. So what does assessment look like? How are you assessing your readiness to engage youth? When you're starting to build those connections with youth, what does that look like from the health department perspective? Not necessarily solely connected to schools, but how are you as health departments connecting to youth? And then for those of you in that innovative space, again, what does that look like around adolescent? Again, all of this framed around adolescent well-being. So we'd love to hear from some of you all on the call as well. Feel free to just unmute and jump in. Great, Jessica.
I can talk a little bit. So actually through COVID is kind of how we rebuilt some of our connections. I started out in the health department as a COVID coordinator, and that's how we got back into schools, at least virtually, to start and made the connections with the administrators and stuff. And then as COVID started to go away, we kept those connections, we kept those meetings. We go into our schools to do flu shots and stuff. A lot of the kids will start to recognize you then. And then we do have smaller communities. We have prevention week this week with our 2 tribes in our area. So we just try to get out and about during that and volunteer, kids recognizing you that way. So with those connections, though, we have built up a few different things. I've been working with one of our schools and going to kids on their level and engaging in things they want to do. So kids love TikTok. So I've been working with them. They're making a anti-vaping TikTok now. They've made a Speak Now TikTok to get it out there. So kind of going on what's gonna engage them is the approach we take and use our education through that way. We do a lot of school garden stuff and getting in with like our younger students with growing their own vegetables and meals and doing that kind of stuff. We are doing art therapy. That's a new thing that we have started. I believe last year we started that. So going in each of our school districts, we have someone that goes in and just does art with the kids, variety of students, old to young, and just getting our faces out there, doing this kind of stuff. It's actually engaged our students a lot more. They know they can reach out. They start to learn about the resources they have during these connections. And yeah, that's just kind of how we keep it rolling. And one thing has turned into another. So, you know, half the time we're there for something and it turns into something else and we're on to our next project with them. And it just kind of grew from there. So that's kind of how we keep it going. We just let it keep growing, and more people find out, more students become comfortable, more people open up about it, and then we keep stuff going.
Thank you so much, Jessica. There was a comment in the chat about if you have links to anything or examples, please feel free to put those in the chat. And we've got Zoe in the background taking some notes from today too. So not only will we share out the recording, but if there are links and things like that shared, if others have suggestions or examples, please put them in the chat. We'll make sure to get an Emma message composed and sent out to everyone after our recording is translated and ready to go. And Jessica, thanks for breaking the ice. Who else would like to share a little bit?
I'll share a little. Lily from Outagamie County. So our county's a little unique. We have 8 school districts that we work with. One of them is, most of the schools are within City of Appleton's jurisdiction, and they don't work on adolescent well-being, but they only want to, even the one school that's in our jurisdiction, they would rather work with City of Appleton. So it's a whole jurisdictional boundary issue. But COVID, so the opposite of the previous speaker, COVID kind of hurt us a little bit more because the schools really wanted to do their own thing, and they didn't really want to involve us very much. So really trying to rebuild those relationships is difficult, even in our basic reach out for just trying to find out if they're doing the YRBS. They're like, oh, you need to talk to this person, but then that person won't answer you. They don't want to talk to you. So then going from there to be like, well, what services do you offer your students? What programs do you have in regards to adolescent well-being? Is just a very difficult conversation to have to even get a hold of the right person to talk to. We're kind of talking around in circles, not getting answers. So it's really hard to then get our foot in the door where they're like, oh, we have this established, we're good, we don't want anything. So then it's very difficult to really get that youth engagement in the work that we do when getting that support with our schools is very difficult. So we're really in that assessment. Every once in a while, we'll get just a very brief, tiny moment of working together, and then it's kind of right back to the beginning. So it's very difficult at times.
Yeah, Lily, you're not alone in that. We certainly heard that from other health departments. And one of the things, so for our school professionals that are here today, a part of the work that we're doing with local and tribal health departments is to really support that youth engagement piece. And we know there's a deep desire to make connections with school districts. And sometimes it's really difficult, like Lily mentioned. And so we know that there are other opportunities or other ways that health departments can also engage youth that aren't necessarily directly connected to schools. And so this will be just, Lily, a little bit of a plug for our June Learning Community Call, but we are going to hear from the Patch youth who have been a part of the Youth Advocates for Community Health process in the last year. They're going to lead the June Learning Community Call. And all that work happened outside of relationship with the school with youth all around the state. So just a unique opportunity to engage youth that doesn't necessarily include that connection with the school in the meantime, while you work to continue to build that relationship there too. So, Carrie, I saw you turn your camera on. Would you like to share?
Yeah.
Great.
I also just wanted to mention, if any of you have private schools in your communities or counties, not to forget them. We do have a hard time getting into our public schools. Our district is so large. And our contact person is the assistant superintendent of the schools, and she's like extremely busy, but we've asked for different contact people, and she said, nope, I'm the contact person. So if you need anything, reach out to me. So I'm actually working with her with trying to implement Handle with Care, but sometimes those conversations come to a complete halt just because she is so busy. So moving forward has been very difficult. But we actually then reached out to one of our private schools. And I think a lot of times people forget about the private schools. And so we're starting on Monday to do mental health presentations at one of the parochial schools in the community, just because, we have come to a standstill in the public schools. So that's just a thought as well for those of you working with the schools.
Carrie, thank you so much for sharing that. I think even in extension, sometimes we have to be reminded that those entities are important and they have needs and we can support them as well. It can also be a great way to begin to make an impact and to have word spread about the work that you're doing. And sometimes that's all it takes is getting in somewhere and having success, and then other schools, other buildings in the district, it might not even be the entire district, but a building, someone catches wind and things start to take off. Great. So I want to pause super quick and just, sorry, Nathan, you get to go in just a second. I'm going to put our evaluation link in the chat because what inevitably happens is we start losing people. So I'm going to put it in the chat. So if you're going to hop off, at least just open up our evaluation link. Great. Just super quick opportunity for you to give us feedback on today and ask for more. And now, Nathan, take it away.
I was just gonna say, I actually have to run to
that's
9
right.
o'clock meeting somewhere else in a different building that I'm gonna be late for, but or a 10 o'clock meeting. Thank you all. I really appreciate it. Let me know how I can be of support. I think folks have email. Pete, I'm privileged to share some space with you here about awesome work in Solon Springs. And I'll see you all later.
Oh, thank you so much for your time. Absolutely. All right. Well, certainly, Pete, I want to give you an opportunity for any last minute thoughts or words to share with the health departments here, and any health departments that would like to share more. Again, that will be valuable for others in the future. That would be great too.
No, I appreciate the opportunity here. And Carrie, I think that is a good point that you brought up about your private schools and your parochial schools. The last district I was in had a parochial school. They had no idea how to make connections. And as those schools are getting more kids coming in on the voucher system, they're starting to experience very much the same mental health and well-being issues that public schools are, and they don't have an idea on who to connect with, how to make connections, etc. So that's a good point, to reach out to them.
Yeah, I think sometimes the schools feel lost. You know, the
Right.
public schools are often like, hey, we're being ignored here, you know? And
Right.
so, you know, just us reaching out, letting them know that we are there for them as well,
Right.
you know, does help.
Yeah, every kid deserves it, so.
Oh yeah,
right.
they've got their own challenges as well in the
Yes.
parochial schools. So
Yeah,
mental health is
absolutely.
everywhere.
Oh, absolutely. The other piece that's been so great coming out of COVID, I would say there's lots of things that have been very negative, you know, for school districts with COVID. But one positive is this forum, you know, the ability to connect with people virtually, and I will say that tool in and of itself has been huge in really fostering the relationship with you know, my current county, Douglas County, and the workers there. We're able to make, you know, monthly meetings because of that. You know, there's that opportunity where we can make those connections, where we can collaborate and brainstorm and whatnot, and we don't have to do that traveling. I'm not saying don't travel, because that was the biggest thing with me making connections with the county, is physically going to their location, saying hi, talking about the great things and the not so great things, and how we can really figure a way forward. So anyway, that's just my 2 cents on it.
Yeah, and Pete, would you say the same holds for health departments, just coming into schools and, you know, coming face to face, even initially, to build those relationships can be really valuable?
Absolutely. A couple of y'all that mentioned the negative response from school districts. I'm sorry to hear that. I would say that isn't necessarily the norm. You know, getting out and meeting the leaders and the individuals in those schools and those districts is huge. It's huge, and that's a great way of building that connection.
Great, thank you. For those of you that are still on the call, I did pop up our learning community call dates. Our next learning community call, as I mentioned earlier, will be June 24th at noon. Again, we're really excited to have Patch take over that session and teach us all what they have learned over the course of the year. I also would be absolutely remiss to not say a huge thanks to Debbie Mollendorf, who is on the call today. She probably, if she could, she's across the state from me, would not be happy with me right now, but Debbie is retiring in June, and tomorrow is actually her very last day as she works towards retirement. She's been an absolutely critical piece of this MCH team over the course of the last year, and I cannot thank her enough. So Debbie, thank you for being here and being a part of our process and all that you've brought to this group. So. All right, with that, I did not expect to get emotional when I said that. So here is our feedback information. Please reach out to us. We have Zoe, again, our amazing graduate student working with us. She's helping us to monitor that email and doing a great job at it. If you're having any issues getting our newsletters or any other information from us, please let us know. We continue to work to solve those dilemmas with you, and we'll work with your county IT departments as well as needed. Feel free to reach out to me. My work cell phone is on there. Again, if you have any suggestions, questions, or support needs, we would love to hear from you. And I believe that QR code will also take you to our evaluation. So we like to make sure that you get ample opportunities to give us good feedback on the work that we're doing and how we can continue to serve you. So with that, it is 10:01. Thank you for joining us today. Thank you for your dialogue and engagement, and we look forward to seeing you in June. Have a great rest of your week.